in the introduction, you say all drugs and all behaviors of addiction, substance dependent or not, whether gambling, sex, the internet, or cocaine, all of them either soothe pain directly or distracts from it. Hence your mantra, the first question is not why the addiction, but why the pain. And I think that beautifully sums it up. You know, in that you're likening addiction to drugs, potentially to, you know, sex, gambling, alcohol, maybe shopping.
Well, so I've had my own shopping addiction, and I can tell you that what happens in my brain when I'm indulged in my shopping addiction is exactly the same that happens in the brain of the cocaine addict. Yeah. In other words, there's an excitation of the reward, incentive, and motivation circuitry. And what the addict is after is that temporary change in brain status. Really what it is, all addictions are an attempt to regulate an unbearable emotional state internally. But you're trying to regulate your internal state through external means. And that's what an addiction is. So temporarily you get a change in the state of your brain, in a change of your physiology. You can do that through drugs. You can also do it through gambling or internet or sex or shopping. But essentially after that same revitalization of your incentive and motivation circuitry of your brain. And so from my perspective, there's only one universal addiction process that dominates all addicted people. The targets of addiction may be different. The internal effects are much the same.
Yeah.
And I'm sorry, I should add, when you look at the sources of it, the states that people are trying to escape are states of emotional distress, states of emotional pain, and hence why the addiction, not why the addiction, but why the pain.
So some people who are listening to this or watching this right now might be thinking, yeah, I get that, that all sounds fine for those people who are addicted, but I, of course, am not addicted to anything. So you've got a rather beautiful definition, I think, of addiction, which I think will be really helpful to sort of go through at the start here so that people listening can actually figure out if it does relate to them or not.
Well, when I speak to a room of people and I ask them how many are addicted, most people will only think of drugs, so some people put their hand up. Then I give them my broader definition of addiction, and not everybody puts their hand up. And that definition is that an addiction is manifested in any behavior that a person finds temporary pleasure or relief in, and therefore craves, but suffers negative consequences in the long term, and is going to be able to give it up. So any behavior, not just drugs. The key hallmarks are craving, pleasure, relief in the short term, negative outcomes in the long term, inability to give it up. That's what an addiction is. And that could be to drugs, nicotine, caffeine, alcohol, the lethal and legal substances, or it could be to heroin, cocaine, crystal meth, fentanyl, cannabis, any number of other substances, but it could also be to sex, to gambling, to shopping, to eating, to work, to exercise, to the internet, to gaming, to pornography, to political power, to the acquisition of wealth, to the hoarding of objects, anything. And when you give that definition, and you ask people how many here would acknowledge some addiction in their life, sometimes the vast majority of people would put their hands up, which means to say that addictions are on a continuum, it's on a spectrum, and they're distributed, dispersed throughout all of our society. And so that the identified drug addicts make up only a small, narrow segment of our addicted population.
So really the whole way we think about addiction, the way we criminalize various forms of addiction really needs to change to a more compassionate way of dealing with it, but also really trying to understand what's the root cause. Because if, you know, I totally subscribe to your theories, and I think that ultimately, if the root cause of all addiction or all addictive behavior is the same, how do we tackle that? And where does that come from? What is that root cause?
So once you're asking not why the addiction, but why the pain, now you have to forget that it's a choice, because nobody chooses to be in pain. And you also have to forget the medical idea that it's an inherited brain disease. You actually have to look at people's lives. Now, in Vancouver's downtown east side in Canada, where I worked for 12 years, with a highly addicted population, these people had multiple addictions, cocaine, alcohol, cannabis, opiates of all kinds, cigarettes in every case. They suffered with HIV, with hepatitis C. They would die of overdoses, suicide, infections of all kinds. And these people, every single one of them had been heavily traumatized in childhood. All the women I worked with over 12 years had been sexually abused. All the men had been neglected or beaten or emotionally abused. I'm talking about now the severely addicted population, which is also what the large-scale study shows, that the greater the childhood adversity, the greater the risk for addiction in adulthood. Now, the more severe the childhood adversity, the greater the risk of substance addiction and injection use. However, if you look at my own case, I wasn't beaten, I wasn't abused in my family of origin, I wasn't neglected, but I was a Jewish infant born during the war in Hungary, and spent my first year under the Nazi regime. You can imagine under what circumstances. So I had a very unhappy, stressed, terrorized mother. And children can be hurt in two ways. Children can be hurt when bad things happen to them that shouldn't happen. That's the abuse, that's the violence in the family, that's the parental addiction. But children can also be hurt when their needs are not met. Now, I had this need for an attuned, empathetic, emotionally responsive mother. She couldn't be that. Not because she didn't love me, not because she didn't do her best, but simply she was too terrorized, she was too depressed. The lack of that joyful, attuned, loving mother who, I shouldn't say loving because she loved me tremendously, but her love couldn't be translated into responsive behavior. That alone was enough to hurt me. So, in other words, the source of addiction is always some kind of a childhood hurt, either because bad things happen that shouldn't have, or because the good things that should have happened couldn't happen because of the parents' emotional states. Both of these are enough to hurt the child in a way to driving them to self-soothe through addictions.
So do you think your own experience of trauma, really, as a young baby, not even a child, as a young baby, has impacted your own health, your own behaviors, and therefore ultimately where you are today, which is one of the world's leading voices on trauma and addiction? Do you think that has been instrumental in you getting to where you are today?
Having to deal with the impacts of that has been instrumental. I mean, I really, as an adult, I was a successful physician. You know, I was much in demand, family practitioner. I was head of a palliative care department at a major hospital. I was a national medical columnist for a Canadian newspaper in my 50s. And internally, I was driven, workaholic, depressed, affected by ADHD, anxious, and unfulfilled and unsatisfied. And it's when looking at those dynamics and wondering, well, what the heck has happened to me here, and what is the gap between my external persona and my internal experience of myself, that's when I began to deal with trauma. Not to mention, as a family physician, and you and I were talking about this before, we get to see patients before they get sick. The specialists only see them after the illness has been diagnosed. I get to see people before they get ill. I get to see people in their context of their multi-generational family background. So we have a much broader view of who gets sick and why. And so both through my medical work and having to deal with my own stuff, I began to realize the central role of trauma in shaping people's health or illness.
Yeah, since I've been studying trauma myself, both with the work that you do, but just other things that I'm reading around it, it really helps me understand my patients and their behavior is much better. I really you can start to tap in now as to what they're coming in with more. You think, oh, that's what's going on behind that, not the symptom they're describing, but why are they making those choices? And something you may not know, Gabor, a few years ago I did a series of documentaries on BBC One called Doctor in the House, and what I would do on that is I went to live alongside families who had health problems. They were already under GPs, they were already under specialists, they were all taking medication pretty much already, and they still weren't getting better and they were still struggling. So I went in to, sometimes I'd stay the night in their houses, I'd live alongside them, really get to understand, you know, what choices they were making with their lifestyle, sure, but also I'd get to see, you know, various dynamics in the family, the sort of thing that would never come up in the consultation room. Even if you ask that question, they would never even think to bring those things up. And you would just start to spot things and little dynamics. And I found that with every single family, pretty much now, if I reflect back on all those families I stayed alongside, I was very fortunate to get really good health outcomes with them all after about 6 weeks. But there was a huge emotional component behind a lot of the illness. Now, just to be clear, I'm not saying that it was in their head at all. They had proper physical symptoms that they were struggling with. And obviously that in some ways can make people feel down a little bit about themselves because they're not feeling so good. But I really got this strong sense that when you start to look at their lives and their upbringing and how they saw themselves, it was uncanny how many times their emotional health was absolutely tied into their physical health.
Well, so one of the books I've written, which will be published in Britain in a few months, is entitled When the Body Says No, The Cost of Hidden Stress. And I'm making the case, precisely as I heard you articulate just now, is that when it comes to chronic illness, and whether it's colitis or Crohn's disease, multiple sclerosis, ALS, or motor neuron disease in England, malignancy, chronic psoriasis, eczema, chronic fatigue syndrome, the physiological symptoms, which are not in people's heads in the sense that they're imagining them, but it very much originates in people's heads in that it has a lot to do with certain relational and emotional patterns that they adopted in childhood. In other words, what I'm saying is that because of childhood programming, people impose certain unconscious stresses on themselves, and those stresses, because of the unity of mind and body, which unfortunately is not taught or recognized in the medical schools, but which scientifically is not even vaguely controversial, because the immune system and the emotional apparatus and the hormonal apparatus and the nervous system are part and parcel of the same system. So when something occurs emotionally, which it does on a chronic basis, that has an impact of undermining people's physiology, turning their immune system against themselves or suppressing the immune system. So I absolutely agree that people's emotional patterns, which reflect not individual choices or mistakes, but multi-generational patterns in the family, those emotional patterns translate into physical illness. And if we can address those emotional dynamics, we can actually have an impact on the physiological course of their illness, which is, again, not something that anybody in medical school will ever tell you, because there's this unfortunate separation of mind and body that you and I are trained in.
Yeah, absolutely. I mean, I think one of the key things there for me was that you're not putting blame on people.
There's no blame.
Yeah, and I think that's really, really a key point that maybe we can discuss now, because a lot of people may be hearing that feeling, you know, maybe I've done this to myself, or my mother did this to me, for example, and that's not what you're saying at all, is it?
Well, this is an interesting conversation. I make the distinction between blame and responsibility.
Okay.
Blame says that you did something that you could have done otherwise, and so therefore you're at fault. That's what blame says. Responsibility says, yes, you did this to yourself, but not consciously or deliberately. You did it because you're programmed to do it by your own childhood experience, which in turn was programmed by your parents' childhood experience. So there's nobody at fault. Everybody does their best, but we do pass these unconscious patterns on. And you don't blame people for having unconscious patterns. You try to make them conscious of it so they can take responsibility for it. So there's no responsibility without consciousness.
Yeah.
And so, and there's no blame. So I don't blame anybody for their illness. I don't blame their parents either. But I do say these unconscious patterns have been passed on, and these unconscious emotional dynamics have an impact on your physiology. That's all. And if you want to have an impact on your physiology, you got to get conscious. You have to realize what have you been doing unconsciously so you can stop doing it or do it differently. So it's a matter of liberating people from these ingrained patterns for which they're not to be blamed. So in my world, there's no room for blame whatsoever. But there is room for helping people to become responsible, for helping people being response-able, being able to respond to their circumstances. And without awareness, None of us are responsible.
Yeah, I think if I think to my own life and my own health journey over the last few years, and I guess what's really changed for me over the last few years, you know, I've done a lot with my lifestyle, I've done a lot with my nutrition, my sleep, and those things have been great and they've really helped me. But over the last few years, I've really been focused on my emotional health. You know, I see a therapist pretty regularly, and I can always feel when I've got something new, some deeper layer that's starting to come out. You know, I have a session or I go through some sort of therapy and I feel good. I feel, oh yeah, you know, I've got it now. I get it why I do this. And it changes your behavior, certainly. But it's almost as you do that, there's multiple layers. It's like peeling back a layer of the, you know, it's peeling back layers of the onion and newer things keep coming out, which has been, it's been really rewarding for me because, you know, you talk about addiction and I think back to my own life and various things that I've done at certain points. You know, I don't think anyone who knows me well, maybe my close friends, but most people probably wouldn't think that I've ever had an addiction because we have all these connotations about addiction. You know, it's like, you know, being on a street corner or being a drug addict or something. Yeah. But everyone around me would know that I've got an addicted personality. Yeah. And I used to think that that was my personality. That's the way I was born. What's weird, that as I start to process my own emotional baggage and I start to clear it, I'm no longer as an addictive person as I used to be. And that's why I kind of feel so strongly about the work that you're doing, because I kind of feel that that wasn't my personality. That was the behavior I had chosen to soothe something that I was missing.
Well, so how would I would put it? I mean, I agree with your concept. I would use a different language around it. Sure. That was your personality, but it wasn't your person. It wasn't who you were. The personality itself is a defensive structure that we develop as a way of dealing with our pain. So much of what we consider to be our personality is actually an overlay upon our true selves. And so these weren't choices in childhood. For example, with my ADD, the tuning out. I never chose to tune out, but when I was an infant under the conditions that I've described of being a Jewish infant under the Nazis, I had plenty of stress on me. And how does an infant deal with stress that they can't change? They tune out. And then the tuning out becomes programmed into my brain. And then so many years later, I'm diagnosed with ADD. It wasn't a choice that I made, it was an adaptation. So what I would say about the personality, including what you described as your addictive personality, it wasn't you, it was an adaptation that you took on as a way of surviving your childhood, as a way of soothing your pain. It's when we get older that we realize that there's something more to us than a personality, that the personality is actually a defensive cover for who we truly are. And as we start, like as you describe your own process, you go through therapy and you go through layers and then you realize, oh, that's not actually me. Yeah. And I'm freer without it. Then you realize that what we thought was the personality was actually just a defensive cover. And once we strip that defense off and we find it no longer necessary, we become much more true to ourselves, much more true to ourselves, so we become much more balanced and happier in our lives. So yes, it was the personality, but you are not your personality. That's how I would formulate it. Yeah, no, I love the way you put that, actually. It really helps me think about it in a slightly different way. I think something came into my mind there, which is, you know, and we were chatting a little bit about this before we got on air, about medicine and how reductionist it has become, the practice of medicine. And I think like something like high blood pressure, for example, I think of as an appropriate response from the body to the signals that it's been given. Absolutely. And I think there's an analogy there with what you're saying, which is if you're surrounded by stress as a young baby, whatever that stress is, your brain is going to adapt to that. It's an appropriate response to the signals that your brain is getting. Is that fair to say? That's right. So my next book is going to be entitled The Myth of Normal, Illness and Health in an Insane Culture. And when I say insane culture, I mean a culture that doesn't meet human needs. So if you take a condition like high blood pressure, For which, what's the medical term for high blood pressure?
Hypertension.
Hypertension. Okay, and doctors, of course, say, our colleagues say, well, there's a few types of hypertension for which there's a cause, like kidney disease or some kind of hormonal disorder. But for most part, we don't know what causes high blood pressure.
Essential hypertension.
Essential, we call it essential, which basically we don't know what the heck we're talking about. That's what that means. Just take the word hypertension and slow it down a bit. Hypertension, hypertension, hypertension. Maybe there's too much tension in people's lives, you know. And if you actually look at the rising rates of hypertension, it's got to do with social pressure and social stresses. And I know that usually when I take care of myself, I have the blood pressure of a young person. But there's been times in my life when I've been driven by stress, and I've had blood pressure ranges in the risky end of the scale. So for me, when my blood pressure goes up, it's a real warning. Buddy, you've got too much tension in your lives. You better do something about it. All we do in medicine is we hand out pills, or we tell people to lose weight, but we never address the sources of real tension in their lives. And I'd say that most hypertension, and so for example, if you look at black American males, they have much higher risk of hypertension than, say, white American males. What we say is genetic. No, it isn't. Their biological relatives in Africa do not have high blood pressure.
Right.
So it's an artifact of being a black male in essentially a racist society. And James Baldwin, the American writer, once said that being a black American male is to live in a condition of suppressed rage all the time.
Yeah.
Well, that suppressed rage will drive your blood pressure. So hypertension...
And drive other ill health.
Yeah.
Yeah.
So high blood pressure is a great example of a socially induced physiological condition which is mediated through our emotions and the impact of our emotions on our autonomic nervous system and on our hormones.
Yeah, it's, I mean, I've never really thought about the term hypertension like that before, you know, hypertension, and it makes such sense when we think about it like that. You mentioned this new book you're writing, talking about how we've got I think, is it an insane society around us?
Yeah.
And I think of stress. You know, as I've mentioned to you, I've just spent a few months locked away writing a new book on stress called The Stress Solution, and I feel strongly that when we talk about making changes, so a lot of people, when they try and improve their health, they try and improve their lifestyle, okay, which is a pretty reasonable start. Mm-hmm. But many people, I find, can't do that, or they do it temporarily for a few weeks, a few days, a few months maybe, but then they revert back. And as a doctor, I've always been intrigued as to why do some patients keep coming back, and why do some patients with the same so-called problem get better with the same course of treatment. Right. And I always think, well, if they keep coming back, I'm clearly not getting to the root cause of the problem. And the more I think about your work, although people talk about you in the realm of addiction and trauma, I think your work doesn't only explain addiction and trauma, it explains all human behavior, and therefore has profound implications, not only for trauma, not only for pain, not only for addiction, but actually the whole of the health landscape.
Well, thank you. And again, in my various books I've written about that. It just so happens that it's my addiction book that's being published right now, first in England. When you get down to it, it's very simple. Either you raise human beings whose needs are met, or you raise human beings in a way that you don't meet their needs. When you don't meet people's needs, they have to adapt in artificial ways. Those adaptations become a source of illness later on. There was a very interesting article in the journal Pediatrics, which is the official journal of the American Academy of Pediatrics, published in January 2012. It was an article on childhood development generated by the Harvard Center on the Developing Child. So as prestigious as you get. And in their abstract, they say that human environments that because of scarcity or stress trouble young children, cause these children to make adaptations which are psychological and physiological adjustments that are necessary for immediate survival and adaptation, but which may come at a long-term cost to health, behavior, and longevity. In other words, the way that young children adapt to stress early on helps them survive that early stress, but in the long term, those same adaptations become sources of pathology. So if you look at my own tuning out, so the tuning out that I did as an infant under conditions of severe psychological strain is an adaptation. It helped me as an infant survive a year where the situation was utterly impossible. But that same tuning out gets programmed into my brain, and now I'm diagnosed with a medical condition, ADHD, decades later. So what was adaptive in one circumstance becomes maladaptive later on. I'm suggesting that much of illness begins with that these are necessary personally adaptations, however, which then stress us later on. And so that there's a real, so what's common to my work is that I look at the sources of adult function or dysfunction in our formative experiences. And, you know, that's not controversial if you look at a gardener. I mean, if a gardener looks at their plants, they know that how they treat that young plant will have a huge impact on the adult plant. Anybody who is in animal husbandry will realize that how you treat the young, whether it's a dog or a horse, will have a huge impact on the personality and behavior of that animal later on. Why don't we get the same thing in human beings? It's the same principle. So it's essentially very simple.
Yeah, it really is, isn't it? When you break it down to the like that, it's super simple. We need a society that really supports children and babies and mothers and parents at a young age.
Absolutely.
And then I guess what comes to my mind is, and you may know the stats on this, I don't, but we here in the UK, we always are talking about Scandinavia, and we talk about how they are really prioritizing those early years. You know, they give a lot of maternity leave, a lot of paternity leave. You know, yes, they may have high taxes, but it seems to me that their society there has prioritized family and bringing up children, whereas I don't think we're quite as good here, but I don't think we're as bad as the US. Mm-hmm. A really good friend of mine, he married an American girl, and she, I can't remember, but maybe after she gave birth to her first child, she might have been back at work. It might have been something like 4 weeks or something. Yeah. Something obscene, like to me, or it sounds obscene to me.
Absolutely.
And the child's in daycare.
Yeah.
And I wonder if you could talk about that a little bit, how society is set up now, and then what that is doing. Because you mentioned your mum's, clearly, that's a huge trauma. I mean, that's hopefully the sort of trauma that most of us aren't experiencing. But are there similarities in terms of what that's doing to the child?
Oh, absolutely. So the United States, which, to hear their politicians, is the best and most glorious country in the world, which itself, by the way, is interesting. Like if you met a person, if your neighbor was always telling you how great he was and how he's the best and everybody wants to be like him, what would you think of him?
Yeah.
You think he's got a grandiose personality disorder and he's compensating for his real sense of deficiency. Well, that's the United States. And they have a lot to compensate for. And what you say about childcare is absolutely true, is that they have a barbaric childcare system, a barbaric maternity leave system, where women, and often poor women on welfare, have to go back to work after a few weeks of giving birth. Now, if you look at human evolution, or look at an ape culture, the ape mothers hold their babies for months. There's no separation. The child actually develops through being held by the mother. And human societies, until very recently, were organized around children being around the parents, really all their lives, certainly through childhood and adolescence. There was just no separation. What we do in our culture, more in the States than elsewhere, but increasingly elsewhere as well, we separate children from their parents. In other words, we're depriving them from the natural conditions for healthy development. Now, there was a study last year or 2 years ago comparing the crying of British, German, Canadian, and Danish children. Lo and behold, Danish kids cried much less than these others. What was the difference? The parents were around. much more. And the parents were much more likely to pick up the kids when they were crying. That's what made the difference. Now, that crying child is an anxious child. When the child is crying, it's not just a benign thing. The child is crying because they're stressed. When they're stressed, their brains are suffused by stress hormones, adrenaline and cortisol. Adrenaline and cortisol interfere with your physiology, interfere with healthy brain development. So just the fact of holding a child, which was historically and prehistorically the standard, is an essential aspect of child rearing, which modern societies have denied. And as a matter of fact, I don't know what it's like in England, but in North America, we actually advise parents not to pick up their kids. When they're crying at night, we tell them not to pick them up. We sleep train the kid by not picking them up. In other words, we're denying the child's needs for connection.
And what's that doing to the child, do you think?
Well, it does a number of things. One is to give the child the message that his emotions don't matter. And children take everything personally. It's not true that babies don't have emotions. And it's not true that babies are tabula rasa, where you can write anything you want. Babies have certain defined emotional needs. And when they get the message that they're not important, that's the message they're going to imbibe unconsciously, non-verbally. And you can see that behavior in the adults. You know, the person who comes into your office and says, Doc, I'm sorry to bother you. I'm sure you have many people much more important than me, but I have this little problem. You know what kind of a childhood they had.
Yeah.
Number one, so it gives
that
them...
That would be me going into the doctor.
Okay.
Or in just various aspects of my life, and, you know, the people pleaser.
Yeah.
Always doing, you know, always, yeah, no problem. You know, the amount of times I think just on a social thing, you'd be like, oh, where do you want to go, guys? Yeah, no worries, wherever. You end up somewhere you just don't want to be in. You're in a restaurant you hate the food in, but hey, yeah, it's cool, guys, no problem. And it's, sorry, I don't mean to trivialize what you're saying.
No, you're not trivializing it. What you're actually illustrating, you're telling me exactly what kind of infancy you had.
Yeah. If you enjoyed that clip, here's another powerful clip that I think you are really going to enjoy.
It is the quality of our relationships that determines the quality of our lives. The story is never just created by one person. It's a co-creation. The way I speak is influenced by the way you listen. The way I see myself is influenced by the way you see me.